when hearing aids are not enough. So we'll start out here with a quick little overview of our team here in Stockton. We've got Dr. Gale, Dr. Awad, myself, I'm the resident, and then Iris, our billing specialist and audiology assistant, and Cherry Henson, our administrative assistant. We also have a lovely team over in San Francisco. Here's all of their lovely smiling faces. They are all very, very accomplished, of course. Okay, so before we jump into our seminar, just a couple of things. If you have any questions, feel free to place them into the chat of Zoom. When we see them, we'll try our best to answer them. We will also have a section towards the end of the seminar for Q&A. So you can also raise your hand during that section, and we'll try and get through as many questions as we possibly can. All right. So then today we are going to talk about several things. We're going to talk about communication strategies, hearing aid accessories, oral rehabilitation, and auditory implants. Just wanted to start before we got too into things with a nice quote, which is, to effectively communicate, we must realize that we are all different in the way we perceive the world and use this understanding as a guide to our communication with others. Anthony Robbins. Okay, I'm going to pass it off to Dr. Awad, who's going to take us through our first section today.
All right, hi everyone. I just want to make it clear we are recording this lecture. So if you prefer to turn off your camera, feel free to do so. All right, so we are going to start off with communication strategies. Next slide, please. So communication strategies 101. Communication strategies are the first step to improving your hearing aids performance. It is important to note that communication is a two-way street, not one way. Both you and the other person must work to communicate effectively. In order to effectively communicate, we are going to go over some speaker tips by Dusty Ann Jensen, who is an audiologist. The speaker tips are from her handbook called 5 Keys to Communication Success. First, we'll go over some speaker tips for at home. These tips include: your listener must see your face. Do not speak from another room. Go to your listener before talking. If your listener misunderstands what you have said, rephrase what you said rather than repeating the same words again. Some tips while you're in the car include: if you are the driver, angle your head slightly towards your listener when speaking. If you're the passenger, look straight at your listener when speaking. Turn off the radio and keep windows rolled up. Then some tips when you're at a restaurant include: be flexible with your choice of dining time, seating choice, and restaurant. Sit somewhere where there is good lighting. Try to sit against a wall rather than a crowd of people so you're not picking up more background noise. Position yourself so your listener can clearly see your face. We all read lips, so it's important that you're facing the listener or whoever you're speaking to in order to get the visual cues you need for understanding. And avoid talking with food in your mouth or with a napkin near your mouth. And then some tips when you're on the phone include: use a landline phone if possible, or even speaker phone. Hold the phone close to your mouth. Avoid multitasking while you talk. Enunciate clearly and use clarifying words when giving numbers or letters. So for example, C as in cat. Additionally, if you or someone you know struggles on the phone, there isn't the option of getting a caption call phone. So a caption call phone is an amplified phone. It provides captions of what the other person is saying on a large screen so you can read the conversation. It's free for individuals with a hearing loss through a federally funded program. The requirements for a caption call phone include a hearing loss, verification of the hearing loss. So you can ask your audiologist to complete an order form, a landline phone connection. If you don't have a landline, there also is an app that can be used on your cell phone to caption the call. And then within a few days after an order has been placed for a caption call phone representative will contact you to schedule a time to come out and install the phone, and they'll teach you about how the service works. And lastly, some tips for when you're at a public event. So these include look for venues with hearing loops or other assistive technology, plan ahead and arrive early to get the best seats for optimal hearing, discuss the event with your listener ahead of time so they are better able to anticipate what may be said or performed. All right, so now we're going to talk about some hearing aid accessories. So hearing aid accessories are a great option for patients when their hearing aids alone aren't enough in certain environments. There are several options for accessories, and which one is right for you depends on your needs. The accessories we'll be discussing today are TV streamers, direct microphones, and remote controls. So TV streamers. One of the first indications of a hearing loss often occurs when watching TV. People living with hearing loss often increase the volume, sometimes to a level that friends or family members find uncomfortable. However, increasing the volume doesn't always mean an increase in clarity. A TV streamer is a device that transmits sound from your TV or other electronic audio devices directly into your hearing aids. As you can see on the slide, there are different TV streamers and each manufacturer has their own. Essentially, all you have to do is plug in a power supply for the TV streamer into an outlet, and then another cord goes into the back of your TV, usually in the audio out portion. A TV streamer allows an individual to watch TV with their loved ones and also provides improved clarity. In addition, the use of closed captioning is important for TV listening. Our eyes and ears work together more than we realize. Looking at what you're listening to helps you hear it better. So closed captioning is critical for viewers with hearing loss, as they may not be able to pick up on important auditory cues that are important to a video story. Closed captioning keys viewers into relevant parts of a video soundtrack, like music, ringing phones, and background noise. All modern TVs offer closed captioning capabilities. You just have to find it in your display settings. Subtitles are also another option that can be used, but subtitles do not contain the background sounds or notifications for speaker changes. Subtitles are nice because they allow people to watch videos when they themselves don't speak the language. The next accessory we'll talk about are microphones. So remote microphones are one of the best options when communicating in noisy environments. It's still difficult. A remote microphone is a small microphone worn by the person you are talking to. It can clip on their shirt or worn around their neck. It picks up the person's voice and it sends it straight into your hearing aids, allowing you to hear them like you're wearing headphones. This is very helpful in noisy places like a restaurant, but can also be used around the house or even in the car. Additionally, students can have their professors wear the microphone to get direct access to a professor's voice in a classroom. There are also table microphones. So table microphones are designed for group settings like meetings, family gatherings, or noisy restaurants. A table microphone is placed in the center of a table and it'll determine the primary speaker's voice and stream it directly into your hearing aids. The last accessory we're going to discuss are remote controls. So remote controls are a simple way to adjust and control your hearing aids. By simply pairing your hearing aids to the remote control, you can make volume and program adjustments. Additionally, the buttons on the remote control are larger and easier to feel and see compared to the buttons on the back of the hearing aids. This makes it easier for someone with dexterity or vision concerns to adjust their hearing aids. Also, remote controls do not require an app or use of a smartphone. Okay, so now we're going to turn it back to Anna, who will present on auditory training.
All right, thank you, Dr. Awad. Okay, so we are going to talk about oral rehabilitation, or as it's sometimes called, auditory training. So what is oral rehabilitation? Oral rehab or auditory training is the practice of teaching your brain to assign meaning to and more easily recognize sounds. So while the ears are things that collect all of those sounds, the brain is the thing that's responsible for processing it. So we have to practice processing those sounds, especially when we've had hearing loss for a very long time. So why would we do oral rehabilitation? It's been shown to reduce cognitive load, improve speech understanding, and improve hearing in noise. There are three main goals that oral rehabilitation programs aim to address: auditory memory, processing speed, and auditory attention. All right. So I know everyone's very eager. How can you do oral rehabilitation? So there are many options for oral rehab, from guided in-person sessions to virtual training. Currently, UOP Stockton, and I believe UOP San Francisco has began working with a program called Amplify. So many in-person sessions have currently been discontinued following the COVID pandemic. Some locations are starting them up again. And if you have private insurance, you may be able to reach out to your insurance to see if they have any suggestions for in-person sessions near you. So I'm going to talk mostly about Amplify today. Amplify is an auditory training program that can be done on your computer or any smartphone or tablet, like an iPad or Android tablet. It's 4 major components. So there's training games, curriculum, access to a hearing professional, and community support. So the first thing that I'm going to talk about is the auditory training games. Their games focus on 9 major skills. So auditory memory, which is the ability to remember spoken words for short periods of time. Auditory sequencing, which is remembering the order of spoken words for a short amount of time. Discourse comprehension, which is manipulating and interpreting long sequences of speech in memory. Speech perception, which is the ability to identify and discriminate between words. Phoneme discrimination, which is just the ability to distinguish certain speech sounds from others. Word identification, it's exactly what it sounds like, just understanding and being able to tell the difference between words that sound very similar. Bound morpheme identification, which is identifying the word endings and understanding that they change the meaning of the words. And then the last 2 are noise tolerance, which is helping to understand words and background noise, and processing speed. So we also have the interactive curriculum. Their interactive curriculum includes, it's a 12-week program with daily content. So interactive content is provided for 12 weeks virtually to your smart device or computer. During that 12 weeks, you're able to take that curriculum at your own speed. You're not required to do it all in one go every single day. And if you miss a day, you can always go back and do it later. There's quizzes and challenges that enforce and enhance new knowledge that you're learning while you're doing your daily content. And then they give you progress reports so that you can track how you're doing over time. The last two components of the Amplify program are the hearing health coach. So it's a chat feature that you're able to send a message to a certified audiologist. So that if you have any questions, they're able to answer it. They usually respond within 24 hours, which is pretty quick. And then the community support. So you can reach out to other people who are doing the program in your community to share strategies for handling challenging listening situations. Because at the end of the day, we're not alone. Amplify, there is a fee for Amplify. It's a program that is 12 weeks, and our clinic offers the discount to our patients. So if you're interested in that, you can reach out to us and we can give you more information after the seminar. There are other options as well that are free. Amplify is just a little bit more involved. So if you're interested in the other options, then again, we can talk about that at the end. Just feel free to ask any questions. Okay. So I'm going to pass it to Dr. Gail now, who's going to talk to us about auditory implants.
Hello, everyone. My name is Gail Armon-Pungshai, and I am an audiologist here in Stockton, UOP Hearing and Balance Center. So I'm going to talk to you about an option when hearing aids are no longer provide benefits, and you try things that Dr. Awad and Anna discuss, and you're still not noticing enough benefits, and you might be a candidate for a cochlear implant. So I'm going to go through what the cochlear implant is, the process, how do you know if you are a candidate, and what to expect after you receive the implant. What is a cochlear implant? It is a type of surgically implanted device that stimulates your auditory system. So when the majority of the patients who we see at this clinic, when they have hearing loss, is usually the type of hearing loss that involves damaged cells in the inner ear. And when the cells are so damaged that they're no longer providing good sound transmission to the nerves, then what you will notice is the clarity of speech is going down. And when it goes down enough, then you're not going to get much benefits from the hearing aids. So basically, these hair cells do not regenerate. So when the hair cells are damaged, either from age, genetic, things like medications, or exposure to loud noise over a long period of time, the hair cells died, or they don't regenerate. That's why you get a permanent type of hearing loss. So the purpose of the implant is to bypass the damaged hair cells and send the sound signals directly to the hearing nerves. Okay, so it bypasses the hair cells and stimulates the hearing nerves directly. So this is an option to improve your hearing when hearing aids are not enough. Next slide. All right, so we get a lot of questions about what do the implants look like? A lot of patients do express concerns about the cosmetic, on the implants. They are afraid that the implants might be way too big and way too visible. So I am happy to announce that there is a smaller option or a less visible option of the implant that recently came out, and both of these options, this is called off the ear device. So basically there would be nothing over the ear. So it's a round little device that just kind of attached to the side of the head. The traditional option is the one that goes over the ear, looks just like a hearing aid, but a little bit bigger. It has a coil and the little round circle that communicates with the internal implant. So the black processors that you see here, either options, are what we called external processor, and what you are going to be wearing on the outside and is, show. So, but these processors do not stay there permanently. You can take them out when you don't want to wear them or when you go to sleep. So the external processor is either worn behind the ear or off the ear. And the purpose of the external processor is to pick up sounds and processes the sound and transmits the sounds to the internal implant. So it's similar to the hearing aid where, the hearing aid would pick up the sounds and processes the sound. But instead of sending that signal into your ear canal, the implant will send a signal up and communicate with the internal implant. When you remove the implant again, and there would be nothing visible from the outside. Now, the internal processor, this is the part that the surgeon will implant inside the head. So there is a little round looking button here. This is what is going to be just inserted right under the skin, and that's the magnet that communicates with the external processor. And then you see a long wire with a little coil at the end. So that little coil is what's going to be inserted in the cochlear of the inner ear. So that's where the hair cells are located at. So the wire will be inserted in there, and that wire has electrodes that communicate directly with the nerves, with the auditory nerves. On this device that you see here, there are 22 electrodes, and each electrode represents from low to high frequencies, just like how the ear works. Our cochlear also, some part of the cochlear responds to the high frequency, some part of the cochlear responds to the low frequency. So the implant is trying to mimic what the cochlear is doing. Now, who would be a candidate for a cochlear implant? First of all, the hearing loss criteria is moderate to severe sensory neurotype. Sensory neuro is the hearing loss that is caused by the damaged hair cells, the inner ear condition, or the auditory nerves. So not things like eardrum perforation or, a fluid in the middle ear. That would be a different type of hearing loss. So sensory neuro is a type that is a permanent type of hearing loss, and the degree has to be around moderate to severe. Now, the second and the most important candidacy criteria is that the patient needs to receive limited benefits from the hearing aids, and that's defined by poor performance in speech recognition when wearing the hearing aids. Now, another good news is Medicare just recently changed the criteria for the speech recognition score, and they make it a lot more lenient so that more people can receive a cochlear implant, and that is less than 60% of the speech recognition score on the ear to be implanted. All right, other factors can include patient's motivation. It is important that the patient is motivated to receive the implant and they are not forced by the family members, for example. And that's because after the patient receives a cochlear implant, they need to put effort into train the brain to learn how to use the new sound, how to understand the new sound. And that's through what Anna just discussed, or oral rehabilitation or auditory training exercises. Family support is also very important. And that's because there will be quite a bit of appointments, at least 2 to 3 appointments that the patient will need to go see their surgeon, and then at least 5 appointments that the patient will come see an audiologist following the implantation. Surgical eligibility is also very important. The patient needs to be able to go through like a regular surgery, and we'll talk about surgery in just a second. But that's why once the patient is a candidate for cochlear implant based on audiological results, then the patient will be referred to see a surgeon, and they will determine if this patient is able to receive or go through a surgery to receive an implant. Integrity of the auditory nerve, the surgeon will also order imaging tests like CAT scan or MRI to see what is a function of the auditory nerves. For example, if the patient doesn't have auditory nerves or they have tumor on the auditory nerve, then that patient might not be a candidate for cochlear implant because we need the nerves to communicate with the implant. Cognitive status is also important. The patient needs to be able to learn how to use the new sounds and interpret the new sounds. So needs to have a good cognitive status. All right, so what is the implant journey? What does it look like? So the first step is you need to discuss your complaint if you do not perceive enough benefits from the hearing aids with your audiologist or with your primary care physician, and they can refer you to see an audiologist. If you're our patients, we kind of monitor your hearing every year already. So when we see that the score, your performance speech recognition score gradually coming down, then we will start to bring up the discussion about implant with you. So if you're ready to pursue the journey, then the patient will come back for what we call a cochlear implant evaluation. And this evaluation is what you're going to be, sit in the booth, wear your hearing aids, and repeat sentences and words with and without the background noise to see how you are performing with the hearing aids. And if that performance is less than certain criteria, then we will say, okay, you are a candidate or not a candidate for cochlear implant. It is important to know, though, that we do recommend this evaluation, even though you're not interested in cochlear implant, just so that we know how you are performing with the hearing aids in general. All right, now the next step, if you are a candidate after cochlear implant eval, then you are going to be referred to see a surgeon for a medical evaluation to determine if you are a candidacy to go through a surgery. The surgery is an outpatient surgery, so it is not that invasive. It takes about 2 hours to complete. The patient can go home after about 2 to 3 hours. Initial activation, so after the surgery, after the patient receives an implant, they wait about 3 to 4 weeks, and they come back to see an audiologist for what we call an initial activation to turn on or activate the implant. After that, then you're going to come see us about 5 more times within that first year. And the reason why we see patients this many times in the first year is because the ear that gets implant is still healing. So the hearing tends to improve over time. We can get more sounds to your brain over time. So that's why the patient needs to come back a little bit more often during the first year. And the last thing is we give our patient who receives implant a homework. And this homework is called auditory training exercise. And that can be through Amplify or the list that we give them. This can be done at home with the family members mainly. And it can be things like listening, the spouse or the family member can read out loud and the patient will just listen through the cochlear implant alone. or listening to the TV, the television through the cochlear implant alone, reading out loud by yourself. So all this training will help the brain be able to process the new sounds faster. What can you expect from cochlear implants? So after you receive an implant, what can you expect? So we always tell our patients that the outcome or the benefits of the implants vary from one person to another person. But overall, we always see improvement in speech understanding after they receive the implant. And this is because once you are a candidate for an implant, that means you perform poor enough that it can't go down, it can only go up. So other outcomes, though, can depend on factors such as age of onset of hearing loss. So when did you get the hearing loss? For example, if the hearing loss happened at birth, that performance, that outcome might not be as good as someone who just lost the hearing. The duration of the hearing loss, did the ear get stimulated a lot before they get the implant? The more stimulation that the patient has through that ear, for example, wearing hearing aid, the better the outcome. The surgical skill of the doctor. The doctor this is very important too. We usually refer you to the surgeons that we trust, so we know that they have really good surgical skills, and that can determine the outcomes. Auditory training, how much work, how much effort do you put in doing listening exercise after the implant? Now, hearing through an implant may sound different at first, but with listening exercises, the brain will adjust to the new sounds. And how does it sound different? It's because the implant is an electrical device. It's going to give you electrical type of sound, not acoustic sounds that you and I are hearing right now. So this is why it's important for the brain to relearn the new sounds. And the last thing is, if you can go through a surgery, you should be able to go through an implant surgery. But of course, there is always a surgical risk that you can discuss with the doctor. One more thing is, a lot of people ask, am I going to still be wearing a hearing aid on the other ear? And the answer is yes. We want both ears to be stimulated still. So if you receive an implant in one ear, you are still going to wear the hearing aid or we recommend you to wear a hearing aid on the other ear. And you always hear better with a hearing aid and a cochlear implant versus an implant alone. All right, and that's all for me. If you guys, or if anyone is interested in discussing an option about cochlear implant, please let Dr. Awad or me know, and we can kind of talk through what the journey and what to expect with you.
All right, Dr. Gale, we have a question from our chat. So the question says, how long does the implant in your ear last? Can you go swimming with it? And what maintenance is needed?
Right, that's a good question. So the internal implant will last forever. Once you get implanted, that stays in there, and you can go swimming with it, and as long as you're not wearing the external piece. So just like the hearing aid, you just take the external processor off your head, then you're not going to hear anything from that side. And you can sleep, or you can shower, or you can go, swimming. There is, for water proof option, there is a waterproof casing that you can wear, that you can put the external processor inside, and that can make it also waterproof if you want to hear while you swim. Did I answer the question? The external processor can be updated just like hearing aids. Basically, every 5 to 6 years, once we deem that the processor is outdated, then Medicare will cover the new device.
There was also another question that I briefly answered in the chat, but it's asking, would damage from acoustic shock syndrome be a qualifier for a cochlear implant?
acoustic shock syndrome. Is that like noise exposure?
Yeah, noise exposure.
Loud sounds, yeah. What is the question be a qualifier for? So it doesn't matter what is the cause of the hearing loss, but things like exposure to loud noise will cause a damage in the hair cells. And if the understanding score is below 60%, and then you have moderate to severe hearing loss, then you might be a candidate.
And there's another question that was just added, and it's asking, I have only one good ear. Will this make my learning after an implant quicker or longer? And then I think, Dr. Gale mentioned that earlier, it really does depend on each person and how long you had the hearing loss. But, there's going to be homework assignments, and the more motivation you have and the more effort you put with those assignments, the quicker your brain learns how to adjust to the implant.
And when you have a dead ear on one side and hearing loss on the other side, it's a little tricky. It depends on if you are a candidate to get the implant on a dead ear. So if the surgeon decides that, okay, there is enough auditory nerves that they will implant the dead ear, you're still going to be wearing a hearing aid on the other ear. And that is, that's always going to improve your performance because you never want anything on the dead ear anyway. So having the implant under the dead ear will always improve your performance.
All right, any other questions? Okay. Well, that brings us to the end of our content for today. So if you would like to book an appointment, here's the numbers that you can reach out to. Oh, we do have one. It says, does the surgery involve any cutting of the ear?
No, the surgery doesn't cut your ear. They're just gonna insert the electrical wire and the magnet piece just right behind the ear. So it's just making, yes, I mean, they will open up the hole and insert the implant in, but it's pretty small right behind the ear. So it's not something that they really cut open. It's not invasive like that. And it heals pretty well. Usually about a month, everything is healed up. By the way, patients start to do better with the implant after about 6 months to 1 year, depending on how much effort they put into doing the listening exercise.
All right, a couple more questions have come in now. I have delayed comprehension. Would an implant help that?
That's a tricky one to answer. It really depends on what's causing the delay. There could be other disorders that might be causing the delay, but if it's the fact that you're not hearing what's being said, it might help, but there's no definite yes or no answer to it.
Okay, then who determines if cognitive levels are acceptable?
We can do a cognitive screening, talking to family members, any diagnosis of dementia or Alzheimer, things like that. And then the doctor will also determine that when you meet up with the surgeon.
Will someone/a candidate need more surgery as new technology becomes available for the cochlear implant? So,
sorry, can you repeat that?
Yeah, so I think what they're asking is if the internal piece will ever be replaced as new technology becomes available.
The internal implant usually doesn't get replaced. It works with the newer external processor, so they can update it so it can work with the new processors, but that part doesn't get reimplanted unless there is a problem with it, like infections or the device is not working. Then they will get reimplanted, but normally no.
There are hearing aids that can be charged by both a charger and batteries. I ask because if the power is out, hearing aids can be charged with only a charger, may not be able to be charged, but if we could put in batteries, they might work. Currently, I don't believe there are any that are available for both. They do sell chargers. There are chargers available as an accessory that hold a charge for a while. The other option is to have a sort of portable battery pack that you would charge in case of an emergency, so that you could plug it in to that portable battery if the power were to go out, and then that battery would then use its charge to then charge your hearing aids.
There is one manufacturer that I can think of that if you need to change the rechargeable battery, let's say it dies, you can change it. We can change it without sending it over to the manufacturer. So that might be an option, but it's both rechargeable battery. It's not like one is non-rechargeable and one is rechargeable. But Terry, we can discuss that. I'm not sure if that's your hearing aid, actually.
Okay. All right, so we'll see if any more questions come in, but I just wanted to make sure that we mentioned that if you feel like you want to schedule an appointment to discuss any of this further, or to come in and have your hearing tested or talk about hearing aids, then you can give us a call, and then make sure you mention that you've attended this webinar when you book your appointment, so that we can make sure you get all of the nice benefits that come with supporting us and attending the webinar. And then again, here's our contact information.